beating at an average of 72 times a minute. Every minute of our lives, the heart pumps oxygen and nutrient-rich blood throughout the body, and at the same time, removing the waste products we don't need. However, when blood flow becomes limited or stopped, the body shuts down, and without intervention, we die. Heart disease is the #1 killer of adults in sub-Saharan Africa, killing about as many people as cancer, respiratory disease, accidents, and diabetes combined. Unlike diseases such as malaria and HIV/AIDS that have immediacy, urgency, and are easily noticeable, the menace of heart-related diseases can be hidden and silent for decades, then suddenly explodes with disastrous complications such as heart attack or heart failure, causing instant death.
Of congenital heart disease in Nigeria is pretty much the same as in other parts of the world, and that means we expect that 1 out of every 1,000 babies born will have congenital heart disease when they are born. Some of those congenital heart diseases would sort themselves out, a very few amount within maybe the first few months of life, close, like a hole in the heart, but a lot of them linger except there are less intervention.
Quite worrisome is the fact that many individuals in Nigeria are living in the ignorance of this menace, forgetting that heart disease is no respecter of persons or status. It is no longer considered the rich man disease, as it continues to rise at an alarming rate, affecting both rich and the poor.
Honestly, I was not sick, but I just discovered I was just perspiring profusely, and I thought I was healthy because I thought perspiration is a sign of health. But my wife reported to my friend, another medical doctor, late Professor Odejide, that I was perspiring, and I didn't feel that anything was going wrong. And Professor Odejide interviewed me, and he alerted my other friend, Professor Dele Falashe, who is a heart specialist, about my state. And they managed to lure me to the teaching hospital, Ibadan, University Teaching Hospital, where a place had been prepared for me for tests. And by the time they tested me, they discovered that I was suffering from arrhythmia. And according to the medical experts, they say, when you are suffering from arrhythmia, you can just be in the church or anywhere rejoicing or dancing and fall to the ground, and that will be the end, and you die.
2015 gave rise to a force poised to change the negative numbers caused by heart-related diseases. Tristate Heart Foundation was born.
At Tristate Cardiovascular Associates, there are hundreds of people that have approached in need of open heart surgery, yet they could not afford it. We have to look for money, raise funds for them. And this led to the establishment of Tristate Heart Foundation. The Tristate Heart Foundation is very, very crucial because in terms of treatment, for those who couldn't afford it, the board members will look for the fund.
Every life counts, and therefore it's our responsibility to make that difference. So for the average Nigerian that cannot afford that cardiac care, we at the foundation want to be responsible for providing that care. And so I would say yes, every life counts, and now there is hope for the average Nigerian to be able to access good quality cardiovascular intervention in our country, not abroad.
We've had people that have supported us, individuals who have had costs to pay for 3 or 2 patients. And we also want to thank organizations like First Bank that actually sponsored the first open heart surgery done by Tristate Cardiovascular. The support has helped people from dying.
There are countless stories of many young Nigerians who have just apparently slumped and died.
After the surgery, he was asked to stay at home for like 6 weeks. Then after that 6 weeks, he's now back in school, doing well, and he's okay.
These stories all affirm a growing epidemic of heart disease in Nigeria and other low and middle income countries. However, numerous Nigerians are unable to access or afford the cost associated with heart disease treatment and depleting lives at an alarming rate.
People have had cause to ask me that the help from Tristate Heart Foundation, who do we give it to? Does it have to do with male or female? Or does it have to do with a particular ethnic group? I want to say that at Tristate Heart Foundation, our help goes to those who deserve it the most. We care for everybody, either male or female, either white or black, tall or short. But most importantly, we care for kids, especially those who are below the age of 10.
It is a sad fact that no one can escape being touched by heart disease or stroke in some way, not even babies.
We are actually appealing to the foundation to help us because the 2.5 million naira is on the high side. My wife is not working, I'm the only one working, and the salary, we spread it out for the year, period of 2 years. That is when maybe I'll be able to get the money we are looking for.
It has just 5 months before the surgery. I'm appealing to all kind-hearted Nigerians, to help save baby Armstrong so that he will live a normal life and grow like other children.
I think it's our collective responsibilities as Nigerians, for prominent Nigerians and average Nigerians, to be able to contribute towards a good cause. When you save a heart, you save a life. And in Nigeria, every life counts. A lot of the people who are predisposed to cardiovascular disease are poor and really can't afford the cost of care. And therefore, we think that every cent, every kobo that you contribute can really make a difference. We need to raise the awareness, get people out there and let them understand the importance of diet, of exercise, of intake of salt, and all the other predisposing factors. We need to get more people on to prevention, and then we need to be able to give them that hope. Lots of children are born with congenital heart deformities, and you know that if they don't get the care before their second birthday, they will die.
We can win more heartbeats if you join us in our aspiration to sponsor breakthrough research, support more patients, and create awareness. Your donation is a life saved. No donation is too big or too small. Every kobo counts and work for the sole purpose of saving a life.
I enjoin you to join us at the Tristate Heart Foundation to make every life count, to make those hearts beat better. As we save a heart, we save a life. Thank you.